Discuss about the palpation of facet joint. How to identify? As you can see that I have already marked the spinal level of the cervical region. C2, 3, 4, 5, 6 and 7. For these are the landmark. Basically all the spinal level is used for localization. Suppose if you are going to identify C2, C3 facet joint, so you can start your palpation from C2 or from the C3 depending upon your convenience. So it is easy to identify the C2 spinous process. So first of all you can see it is marked. So place your hand or thumb like this, then slide your palpating thumb or finger over the lamina of the vertebral arch. Shift the paravertebral muscles, these contour, or you can feel the belly here. It is basically because of your cervical muscles and your trapezius. So slide your thumb pad, try to feel the lamina, arch of the lamina, shift this belly laterally and try to identify the bony prominence. Basically, it is a bulging structure. Your zygapophyseal joint or facet joint is a bulging structure, and as you apply the pressure over this structure, so it is pain sensitive. Patient will just try to means contact the muscle. So your palpatory finger pad pressure should be very little, and try to shift it over the lateral side, then few down from the level of C2 spinal level. It should be shifted little bit inferiorly. Then apply gradual pressure and try to identify the bulging structure. So I have already marked here. Is it paining? Dard ho raha? So this is the method for palpation of facet joint. For every segment, suppose you are going to identify C4, C5 Zygapophyseal joint. So you can start your palpation from C4 or from the C5. What you have to do, you have to start your palpation from here. Suppose I am going to palpate it Zygapophyseal joint between C4, C5. So first identify the C4 spinous process, then slide it laterally over the lamina, shift the muscle belly laterally because this joint is formed by the C4, C5. So you have to shift your thumb pad little bit in inferior direction. It is very, the shifting of the thumb pad, it should be very little. It should be in millimeter. So just adjust your pressure and try to identify it. This is the first method. But most of the patient, if muscle is relaxed or it is tension free, then this procedure is easy. Otherwise, sometimes because of the contraction or hypertonic state of the muscle, you cannot shift or you cannot push this muscle belly laterally. So what you have to do, suppose again I am going to identify the C2, C3 level. So first of all, identify the spinous process, then shift it laterally and little bit down. Try to feel the bulging bony structure or bulging bony consistency. If muscle is interfering, then same time you have to apply in the same line of the palpating thumb, another hand or another thumb you can place in the same line, release the pressure from the paravertebral muscles of cervical region and gradually release it, and same time the another thumb is trying to pushing this belly medially. So you have two options. If muscle is relaxed, so you can identify it directly. If muscle is interfering, So you have to come from this side, from lateral to medial shift of muscle belly, and again apply gentle pressure and ask to the patient, is it paining? Same time, you can feel the bulging structure, and it is because of the pain sensitivity, patient will complain of pain. For the rest of the structure, you can repeat same procedure. Suppose you are going to identify C3, C4 level, so you can start your palpation from C3, shift it over the lamina, then try to identify, shift, adjust your thumb pad little bit inferiorly, try to identify the bulging structure, and that will be your level of or zygapophyseal joint at the level of C3, C4. So you can identify any level by repeating this procedure. That's it.